everyone, and welcome to tonight's webinar. What we're doing is exploring the pandemic's effects on specialists in general. I want to welcome you to the Henry Schein webinar. I'm Dr. Gary Severance, who will be moderating the program, and we have some very special specialists with us tonight to do a roundtable discussion. You should know there is no CE available for tonight's program. It will be recorded and available, and you'll receive an email if you registered for the webinar sometime next week to see this as well. What I also want to relay to you that we will finish on time tonight because we're essentially the pregame show for the college championship tonight. So we appreciate you joining us. And with that, what I'll do is turn it over to some of our panelists. I'll introduce them briefly, but then ask them each to give their information as well. Starting with Dr. Heidi Kohltfarber. She's the owner and lead oral and maxillofacial radiologist for dental radiology and an adjunct professor for the Department of Diagnostic Sciences at the University of North Carolina at Chapel Hill. Dr. David Wong is a board-certified periodontist in private practice in Tulsa, Oklahoma, and Dr. Tadros, an endodontist in Hudson, New Hampshire. I want to welcome you all here tonight and thank you in advance for all the great information you'll provide. Because as I mentioned or have seen before, the ADA has done a wonderful job of giving a general idea in their HPI division of where dentistry is and how it's progressed through the pandemic into this pandemic era and hopefully soon post-pandemic, but it's changed everything that dentistry has done. And it gives us a general scope of where we've been in March of last year and where we're going to in March of this year. But I think it's extra special to look at specialists in the practice that rely on referral base in many cases to see how that has trended as well. So we'll get their information for providing that. If I could, Dr. Kohltfarber, if you would join us first by just giving a couple-minute overview of you and your practice and your business.
Absolutely. Thank you very much. I really appreciate this opportunity as well. Always fun to be able to sit and talk with everybody and see what's going on. And a little bit about myself. I went to Loma Linda University Dental School and graduated in 2003. And I was a general dentist for 6 years. I got really excited about 3D imaging. And I got so excited about it that we packed up the entire family, moved back to North Carolina to go to UNC Chapel Hill, and I took a 3-year residency in oral and maxillofacial radiology. And then, of course, I took the 2-part board that goes with that. But I wasn't done because radiology is so awesome. You cannot have more fun than this. And so I decided to do a PhD that was a joint venture between UNC and King's College London. And that was all focused in the craniofacial region. So specifically, my PhD research was all within the temporomandibular joint area. But it has just been an amazing ride. I've really enjoyed it. I started a private practice at the same time I was going through the PhD program, which was kind of a hefty load to take on. And so we grew as a group. So there's a group of us radiologists that are part of dental radiology diagnostics. And it has just been so much fun. We do a lot of lecturing with the imaging companies, and we get to do a lot of research. And of course, we get to see a lot of fantastic cases that are sent to us. So that's, pretty much everything about it. I do have 3 girls. I am married. 3 girls. They are, 15, 13, and then we had a little surprise, and she's 3. So she keeps life interesting.
Yeah, your life is planned out now for the next many, many years, huh?
It is.
I've certainly attended many of your programs and webinars during this time as well, and certainly recommend it to anyone wanting to know a bit more about that field. So appreciate it. Thank you again for joining us. Dr. Tadros, the man with the first and the last name the same, as an endodontist up in New Hampshire. Can you tell us a bit about your practice, please?
Sure. Well, thank you everybody for having me tonight. My name is Tadros, and my first and last name is the same. It's not a misspelling. The name is so nice twice. So I I'm a board certified endodontist. I practice in Hudson, New Hampshire, which is in the Great Nashua area, at the border between Massachusetts and New Hampshire. I've been practicing in this area for about 2 years now. Before I was practicing in Boston. I did my dental school at University of Washington in Seattle. And after that, I did my endo residency at Boston University. After that, my family were like, we live in Palm Springs, California, but I met my better half in Boston, and I've been in the Northeast since then, and I indulged all the snow and all the cold weather and all that great outdoors and all the four seasons. So I've been living in the Northeast since 2017. In 2019, I bought my practice in Hudson, New Hampshire, and we're basically serving all the area of Nashua and beyond. And I'm also a captain in the Army Reserve. I've been with the Army since 2017 as well, and I'm still with the Army till now. So very grateful, very happy to be part of this great entity, as well as to add like to build my practice and to also add my experience being in the Army as well. So thanks again.
Wonderful. Thank you for the service, not only to dentistry, but to the country as well. So thank you. Dr. David Wong up in Tulsa, Oklahoma, periodontist. Dr. Wong, could you tell us a little bit about yourself?
Yeah, David Wong. I've been in practice about 18 years. I'm a private practice periodontist. Do quite a bit of speaking and consulting as well, and then do a little part-time teaching as well at the University of Oklahoma, and a little bit online at UPenn. So that's me in a nutshell. Married, 3 kids. My kids are older and self-sufficient, which is really nice, 16, 14, and 12. So I've got 2 girls and a boy, and the boy's in the middle. I was born and raised in Oklahoma. After most people, start to pick up a little bit of a Southern drawl, which kind of throws them off, being that I am 100% Chinese. But yeah, born and raised in Oklahoma, went to the University of Oklahoma as well, and did my periodontal residency at the University of Missouri in Kansas City, and then just moved back to Tulsa because I also met my better half, Dr. Tadros. I totally get where you're coming from here. So she brought me back to Tulsa, which is a beautiful city. We've been here ever since 2002, actually. So yeah, I'm just now entering my 18th year in private practice.
Congrats. Yeah. Well, thank you all for joining us. What I wanted to do is ask a few questions, and we'll go around and get everybody's response. And if you have any other information you want to add, please do it, or intertalk. The other thing is, any attendee that's watching this can, in the question and answer, give us a question too that we can pose to the entire list, or at the end we can do one by one. So the first question is, how has your specialty practice and your referring base changed from pre-pandemic to the COVID era we're in now? Dr. Padros, could I have you go first, please? How has it changed from March of last year to March of this year coming up?
So, I mean, like any part of the country and the world, the pandemic took us all by surprise, and there was a lot of time of uncertainty and unknown and lots of misinformation around. So being an endodontist, serving the area where I'm serving in time of the pandemic, especially in March, the relationship with my referrals became more of a resource and support, meaning that we stayed open the whole time. My practice has not shut down a single day. We stayed open the whole time. And the reason we did that is basically to be in there and to serve patients, seeing dental emergency, and endo is not really like something like you choose in the morning to do. It's something that brings you to a specialist. And because when we saw how struggling where the ER and the emergency rooms in the area where we are serving, we found an obligation and a duty to be able to serve and stay open, and to help like reducing that part, or like the heavy load on the urgent care facilities in the area. Definitely, we saw lots of dental emergencies, from traumas to like many cases, and we will talk about this later, I'm sure. But the most important part, becoming a resource and try to basically dismiss any misinformation out there. Try to assure referrals, being there for them and being there for their patient. And definitely that help increasing the trust. It's not just a business, like we're not just there to like get money or like make money. We're actually there to serve and to be a good resource and support to our referring patient, which also helped reinforce this relationship that we have built with many referrals in the area. And it kind of also shed the light that the importance of having a relationship with local specialists in the area. So general dentists, when they go and move to an area, it's very important to build this relationship with a group of specialists to be your support and to help your patient and basically to navigate during these tough times from from resources for PPE, air filtration, all the sort of things that like there are many courses now about them. At this point in March, there were really nothing available. So being a specialist in the area made us basically an important resource in time when there was no resource available and there was just panic and misinformation all around the internet and so on and so on.
Yeah, you were probably one stabilizing position for the dentists out there that did have to close, knowing that you were always open. You missed out on a lot of webinars that were given during every day of every day.
I had in the beginning, like when my first webinar I had to attend, I had a hard time navigating with Zoom, and everybody was like, "What are you talking about?" Everybody doesn't know how to use Zoom, and I'm down struggling because I didn't have to use it.
Yeah,
but we actually like even by numbers, we even helped decreasing the load of the urgent care facility in Nashville by about 30%. Just by sending like the information like, hey, like if you have a dental emergency, don't go to like the urgent care. They're not gonna do anything for you because they haven't take care of. Just give us a call or come to us and we will take care of you.
Great. And maybe a little bit later, we'll touch on how you communicated that to the hospitals and other areas. Dr. Kohltfarber, can you address that? How has it changed? I know you have probably a different referral base when you have the virtual reading of radiographs and CBCT, but how has it changed from last year at this time?
For us, we do a lot of courses. And so a big part of what we do is educating our referral base. And of course, we are used to doing that in person. And so, I think we flew a lot. I was out probably, at least several times a month, crisscrossing the country for various courses and that sort of thing. And of course, those were all brought in house. And so, as Dr. Tadros said, was, trying to figure out all of the, the software navigation and the Zoom and the, what's HIPAA compliant, what can we use? It was a little bit interesting. And we have a online website that we've been working on that we want to take all of our lectures and put it online. And it wasn't quite ready to go. It's called DRDX Docs, but we went ahead and just opened it up so that we could do free webinars. As was already mentioned, there was a lot of misinformation out there. We wanted our referring doctors to know, especially what to look for. We knew that a lot of patients weren't seeing their healthcare providers. Everybody's afraid to go to their healthcare providers. We don't know, where we might catch something. And while there were, various places throughout the country as they were closing down, we know that people by and large went to their dentist more than they would go to a healthcare provider, especially near the end of some of the shutdowns. And of course, some places are still shut down, such as California, where I'm at, still kind of difficult for us here. Okay. I think my kids have been going to online school for about 10 months now. But yeah, it changed quite a bit. And so being able to provide webinars, telling people exactly what's going on out there, being able to remind them the difference, say, between, benign versus malignant tumors, especially as some of these patients that really should have been followed up with their dentist, some of our cancer patients, followed up with their physician, were coming to their dentist. And so for us, I think even the types of cases and so forth that we saw were much more severe than we've seen in the past. We actually had a group that was out of Florida where the physicians wanted to get their patients in for follow-up with various cancers, and were having difficulty even getting those patients in for medical CTs. And they ended up sending it to a dentist to get cone beam CTs. So we started reading those. So obviously, we wanted to read whatever it is we could. We wanted to be there. We know that a lot of times, not only are we a referral base for our general dentists, but we're a referral base for our specialists as well. And so if there's a question about anything, we wanted to make sure that we were getting those out right away, and that we were able to provide the appropriate steps and management for those cases.
So you didn't have any downtime either then, right?
We did not have any downtime. In fact, it really was bizarre watching everything go, because we do read for other countries as well. So we are global.
Yeah.
So we could watch the country shut down, we could watch the states shut down. And it was just a really unusual occurrence, as I know it was for everybody. But yeah, we stayed busy. It was just a really big time, of course, of uncertainty, and still is. There's still a lot of information or misinformation that's out there. And so I think, for us, it was really honing in on bringing more things online and figuring out the platforms and the ways to do that. So
Great.
Yeah.
Thank you. Dr. Wong.
So referral patterns have changed, quite a bit for us. So in Oklahoma, we were shut down for about 6 weeks, and even though that we were considered an essential business, but we were ordered to only see emergencies, which emergencies are kind of loosely defined depending on who you ask. So we made this decision just so we wouldn't, get told on or tattled on, just to shut down for 6 weeks. So fortunately, the weather was really good, so I got a lot of pool time with my kids, and we just hung out. So it was kind of nice for about 6 weeks. But as far as referral patterns go, it was interesting. I was pretty dead, for March and April. I didn't do a whole lot, pulled the occasional abscess tooth and that type of thing. But I'd say, referral patterns, how they've changed from now to then. It went from, pretty much just extractions and abscesses and things like that to now it's kind of a more of a normal thing. Like you and I were talking about before we got on board, now we're doing our multidisciplinary cases, our cosmetic cases again. So things are more back to normal. I would say the biggest thing in the beginning was as a specialist in perio doing surgery and things, a lot of the doctors just weren't familiar with, what proper PPE was. So they would know, hey, what do you wear, when you do surgery? Because I think I'm going to have to wear the same stuff, because a lot of the doctors here in Tulsa, they wear, a shirt and tie, to really give a good impression, or to really show, a different level of professionalism versus the scrubs. So they didn't really know what PPE was, and they were struggling to get it. So, for me, I've always been a hoarder. So I had all this PPE, hoarded away. But we saw that, so I think just like with Dr. Tadros, Dr. Kohltfarber, I was a resource for proper PPE and education and that type of thing. But referral pattern wise, it's been interesting coming back. You see, fewer older patients at the beginning when we came back in May. And then now as they're getting out, either they're getting stir crazy or less scared or whatever, they're all coming back. I had several patients today comment about, hey, I'm getting this stuff done like at your first available appointment because, I saw what neglecting my health did, to other parts of my body for the last, 2 or 3 months. I don't want the same thing to go to, to happen with my teeth. So I'd say people are a little bit more motivated to get scheduled, faster now. You don't have to talk them into things as much. They see things more on they see the urgency more than they probably would have a few months ago. So that's how, most of our referral patterns have changed, a little bit more urgent, tackling things with a more sense of urgency than before. So.
Yeah. And I think all of you referred to it a bit, but dentistry, is still one of the most trusted professions. So, going in Dallas, people would go to their dentist before they go to the restaurant even. So I think you've all seen that, and we're great supporters of the GP realm as well throughout this. So thank you. And then comes to the question that was brought up. What different methods are you reaching out to either your referral base or your patient base, or expanding it? You probably got some new referrals during this time coming back because of pent-up demand, or Dr. Tadros, you were open the whole time as well. Are you communicating either, and I think on your websites, you're doing some different things, communicating to your patient base maybe, but also to your referral base? Can you explain how that's made to your referral base? Dr. Wong? Okay, Dr. Tadros.
Sorry. I'm sorry.
Okay. No, go ahead.
Oh, okay. All right. So I regarding communicating with referring base or patient, social media was a very, very helpful tool this time. At a certain point where I have my practice, we were the only endo practice open in the whole state of New Hampshire. Wow. So that definitely, I would say, we've seen patients who drove for almost 60 or 70 miles to come and see us. So that's how far we were able to reach. The other important part here is that I used to basically do a 1 or 2 minute video every morning, or every week, basically explaining what's going on, what's happening, how are we doing, explaining and these videos were kind of addressed to both referrals and patient. Again, dismissing wrong information, misleading information, explaining what we do, showing videos of our PPE, our the modification we're doing in our work, explaining things giving advice to patient about don't go to urgent care facility if you have a dental problem. Give us a call. Call your dentist. If he doesn't answer, give us a call. Things like that. We had a very, very good feedback, and it definitely helped our how we reached out to this. When dentists start to reopen again, we definitely reach out to our regular referral. During that time, I would basically give them a call or text them every other day. So some group of referrals, how you doing? How's everything going? Let me know if I can help. You have any questions? This and that, and I used to do this almost on a regular basis, maybe text maybe 10, 15 referrals, different ones every day to kind of see how's it doing and everything. So that kind of helped us to also show them that we are a good resource for them. When they reopen, we send them postcards, say hey, how are you? And well, we just want to say that we're here to offer you support, as we did during the pandemic, before the pandemic, and now. And most important part, increasing awareness, which was very, very important, that dentistry is safe, dentists are safe. Our universal precaution and our PPE and all those sort of things, if we apply them right, we were all going to be safe, and safer to be in dental office than to even go to a grocery store. Yeah. So that's how we use that. These are the methods we basically employ to reach out to our referring base, or expanding it also to patients as well.
That 2-minute video each morning, was it, what social media platform did you do it on?
So I have two of them. I have the Instagram one, which is mostly I reach out to dentists and dental student referrals. I'm sure Dr. Wong has an amazing one as well. So this is the one I reach out to professionals. The Facebook one was mostly directed to patients, dental office staff, assistant, hygienist. I'm not sure how things were for other states, but I know in New Hampshire there was different some information basically going from from hygienists about how unsafe dental offices are. Not all hygienists, but very, very small amount of hygienists. they were, again, like, again, there was lots of misleading information. So I can't really blame them for that, being also an employee, not an employer. So we had to basically like we use like those videos to kind of like dismiss all the misinformation and to also give alternative. Okay, we use this. You can use this, if you cover them and if you disinfect the tools before you do or you got your prep, you will be like this is safer option. Using the face shield properly, like putting like your N95 mask or regular mask properly. These were all good videos, and I mean, like right now I don't do them anymore, but like during that time, like in the morning, once I arrived to my office around 7:30, I would just go in, like record 3 minutes video on my phone, and that's it. It was very, very useful.
Great, good. Let's go to hashtag Dr. Wong, the influencer. How did you message to your groups and keep communication with them?
I was a big social media guy too. I was too lazy to do original content. So I just reposted other people's stuff. So I think that's always a good hack, to just follow some accounts that are like yours and just repost. I think that's just as good, especially whenever you don't have a whole lot of time. For me, the reaching out to referral base, it's really interesting in Oklahoma because we have a lot of people, everything's just a handshake deal. Everybody loves to touch and hug and be in person. Yeah. And for the last, I would say 5, 6, 7 years, I have been wanting to do virtual meetings in teledentistry and do my, referral, like I want to do consultations with my referring docs about a patient via Zoom or GoToMeeting or Blue Jeans or whatever the platform may be. They've always been like, no, just come over to my office or I'll come over to your office. So the one positive thing about the pandemic has been they've been open to like, what was that Zoom thing you were talking about? How do I do it? And now they're actually open to doing things virtually and online. So that's been kind of a neat thing. Patients too, there's a lot of elderly patients that are like, is there anything we could do? So we have I've got my Nomad and we have some old phosphor plates, where we can take x-rays in their car in the parking lot, we process them and then I just, tell them what they need to do, or if anything's an emergency, if anything can wait or whatever. So we've had some ways to reach out to patients that way. The biggest thing is, the patient that, used to get annoyed with all the text messages. Now they're like, hey, thank you for them. I really appreciate that. I'd say, starting, maybe a month after we were back, my study club members were already like, hey, when are we going to meet in person again? Because I am ready for some human interaction. And, fortunately, there's only like 15 of us. So we were all like, let's just go meet at David Wong's office. I've got a study club area upstairs. So they're like, let's just meet up there. I mean, we've all been seeing patients all day long. I mean, if we're going to give COVID to each other, then we would have given it to our patients too. So let's all meet finally. So we've resumed study club things again, which is great because, as we all know, as specialists, I mean, study clubs are a great way to really, number one, interact socially, but number two, really share ideas and cases and get back to the business of treating patients again. So that's been really good.
And did you try to maintain the study club at all virtually?
Yeah, no. We didn't. Although I will say it depends on the parts of the country. Like this Thursday, I'm going to be part of the study club in Seattle with the Sphere Study Club that I'm going to be, part of. It's virtual. They're meeting virtually. I think a lot of my California friends are still meeting virtually. But in Oklahoma, we all just kind of messaged each other. We have a group chat, and we were like, you guys just want to do this in person? And we were all like, yeah, let's just do it in person. So
right.
In-person meetings, and for us, we're a smaller state, smaller population and things. So we're doing things. We're the anti-establishment, I guess, over here.
Oh, great. Thank you. Dr. Kohltfarber, I know it sped up, the pandemic kind of sped up your introduction of the virtual world. But I think in your specialty and profession, it probably helps a great deal now being ready for it going forward. How did it change in other ways?
Well, I think that, probably the biggest was moving us quicker into the virtual world. I think as far as, keeping our finger on what everybody was doing became really important. And so, of course, talking to all of our clinicians and that sort of thing became very, very important. We also, of course, on our reports, went ahead and put my cell phone. If they want to call me, they can personally call me and talk to me, talk to a live person. It's going to come directly to me. A lot more of, you know, emailing, phone conversations, Zoom, that sort of thing, with all of our clinicians. And I think that, just having a handle on the questions that are out there, how can we be more service oriented? How can we be almost, like the radiology in your pocket? If you've got that emergency in there, we want to make sure that that there's somebody behind you and with you. Um, we also worked with Dentsply Sirona to put a plug-in button in the software. And so that's something that if you have a certain type of CBCT and a certain type of software, you can go ahead and get a plug-in that you basically just press the button and it sends your case directly to us, directly into our servers. It's all HIPAA compliant, secure servers and that sort of thing. And so it really helped us to be able to kind of streamline the process, make it even easier for clinicians to send us a case, ask us questions, and that sort of thing. But yeah, I think it was very eye-opening. It pushed us, like we talked about already, in a way that we were planning to go, that we were already putting together, and so that was fantastic. And we actually hired some new radiologists as well, so that was great. It's yeah, I think that the virtual part of it, people got a hang of so quickly that it helped us in what we do, because of course our referral based is based on, whether offices are open or closed. And so,
Right.
we want to make sure that we're there to be able to help everybody, and really be able to be, like I said, the radiologist almost in their pocket. If you have any questions, we want you to be able to get a hold of a person, and we want to make it as quick as possible. So
Right.
we also instituted a ASAP because we wanted to be able to figure out, obviously if someone's concerned about cancer, if we've got a cancer patient coming in, we want that person to go to the top of the list. We don't want them to be stuck down around, just the general overreads that we get. And so we started instituting some things to try to separate out and let us know who is really the emergency case and that sort of thing. So
Yeah, that's great.
Yeah.
It sounds like all of you, not only survived but thrived during the time as well, because you had more people referring, possibly different cases, and increase. And we just got a great question from Jack on the question that I'll bring into it to summarize this part. Do you feel that your efforts to assist your referring doctors during the closure period resulted in an increase in loyalty and referrals afterwards? Dr. Tadros?
Absolutely, 100%. With respect to my other colleagues, I'm probably like the youngest guy in this platform. My practice, I started in 2019, so it's fairly new.
Wow.
Yeah. But at this point, like where I'm at pandemic, being there, opening, staying there, dismissing all the wrong information, taking care of patient, being there for referral has definitely set us apart as a specialty practice, and also has set me apart as a specialist. I'll be always reminded by this endodontist who stayed open when everybody was closed. So definitely helped reinforcing my relationship with my existing referral, knowing that I'm there for them, I'm there to serve their patient, and I'm there to support their practices. Also bringing new referrals who have never me before, have not even seen the practice before, none of this. Now they became a lawyer referrals, because they know that the quality of care we provided during these tough times and how much of support we provided to them. So absolutely, it was it was very, very important to during this time to stay open, and it definitely helped our relationship with referring doctors to be strengthened and to be built this way.
That's great. And I'm sure seeing your office every day for a couple of minutes, or your surroundings, and seeing that you're up and at them and, there for answers anytime really helps. So that's great. Dr. Wong, similar feelings?
For me, I would say my answer is actually going to be, it's probably too early to tell, regarding the loyalty part of it. It's just that, after 18 years, I know, we do lots of things, right, for our referring doctors, whether it's, seeing their patients for emergency, call me, we'll get them in, that type of thing. And over the years, it's kind of a funny thing, sometimes, people are very loyal to a T and they're by you, and then other people, all it takes is, some new guy in town that brings them some donuts in the morning, and all of a sudden they're gone. So, some referring offices can be fickle that way, but many are very, very loyal. So I will say that. But I'd say for me, it's going to be a little bit too early to tell. We'll see next year.
So
it is a number I do track, by the way. So every year I run the numbers to see, who my top 30 referrals are, and then it is funny. I mean, they do change year to year sometimes. So
yeah. And there's a difference between 18 years and 18 months, right? With Dr. Tadros.
Yeah, for sure.
It's certainly a great barometer in that case. Dr. Kohltfarber?
Yeah, absolutely. I think that we have just some excellent doctors that we have the privilege of being able to serve. And, we did see, those people that know that you're going to be open, they know that if they need you on the weekend or if they need you on a holiday, you're there for them. Definitely are still sending. But because we also kind of help people to better understand how to read their CBCTs, we also had, anybody that was newer to the market, especially at this time, they really couldn't go out for any type of training. And so we did have, quite a few newer individuals, and especially with that button that we instituted in the software, we did see our referral base change, and we have quite a lot of new referrals as well. But I think by and large, it did increase the loyalty among those that we'd been helping out for years as well. So
yeah, that's great, and especially being global as you are. And people have to go virtual for some things, especially it might be this, and you were there as a result. So certainly understand that.
Yeah.
We've talked a little bit about, and I think Dr. Wong brought up teledentistry, or Dr. Kohltfarber, one of you mentioned that. Are any of you using teledentistry with your patients and or your referrals for the virtual type of study club or others? Dr. Wong, I'll go to you first here. Are you using teledentistry?
Yeah, I mean, so for me, I think what's been neat about the pandemic, I mean, and how you kind of transform your practice. I mean, for me, we're a boutique practice. It's a fee-for-service setup, so it's been really important in the previous 18 years to really go above and beyond service, and that sometimes it's it relates to doing the coffee bar and all that other stuff in the office that you don't do anymore. So you don't do it anymore, and patients don't care either. And you realize how much, maybe built in unnecessary things you do that you think people want from you that they really don't care. So things are we used to build in, these service appointments where we would just, have them come in as a courtesy, and we would do a dog and pony exam and give them all this stuff and throw in these CBCTs just to show them, their skull, and just to get the look on their face like, wow, is that me? So those are things that we just don't do anymore. They just don't, and we haven't found that they need that. So whenever we can, we incorporate teledentistry. So for me, as an example, being a periodontist, if we do a gingival graft or something, I would really put the kid gloves on and make sure we walk them through and do all these, post-op appointments to make sure that they knew that we, were caring for them and thinking about them, which we are. But nowadays, I just give them my cell phone number, just like these docs do. And I just say, hey, look, you're 70 years old and you're going to take your first selfie. So you're going to go to the mirror, you're going to pull your lower lip down, and you're going to take a picture of it, and you're going to send it to me. And it's really neat. It's hilarious, watching, some of the people who have never done like a video call, do one for the first time, because it's like, we literally have had, couples like yelling at each other, like, you're supposed to look here, it's around backwards, you're looking at the ceiling fan. It's pretty funny. It's pretty funny, but we all have a good time, laughing about it, and it's fun watching them do it. But the answer to your questions, we do a lot more from the exam. Like I do a lot of like, I started isolating little things that I can do via teledentistry, which is, hey, I can see really quick if you have recession, and generally can tell, if I can fix it and how we're going to fix it. So we just do that, and it's a value-added service, because sometimes we don't even charge. Most of the time, I don't even charge for it. I'm just like, hey, just shoot me a picture or get on the call with me. I'll just tell you real quick. If you want to do it, great. If you don't want to do it, no big deal. So it's nice and convenient for patients. Like I said earlier, it's something I've been wanting to do for years, but nobody ever wanted to come on board, and now they're finally ready. So we do it whenever we can, and it cuts down on our workflow, cuts down on a number of appointments. It's really nice.
Yeah, that's great. And convenience for the patient, right?
Oh, yeah.
And the risk for your team or your patients are.
Yeah, and less money, and they like that too.
Yeah. Just interest. Do you keep those images and put them in the patient's file?
I do. So we just upload it into their software, and then I'll type up my notes. That's the one thing I'm bad about, is when I do teledentistry, sometimes I do it at home and I forget to come get back on my software and type it in. So I get it. The girls chew me out. They're like, they called the schedule, but you wrote nothing.
Great. Dr. Tadros and also Dr. Kohltfarber, it's a little difficult to do at-home radiographs or x-rays. So how are you, if you are using teledentistry, Dr. Tadros, or communicating with the patients or referral basis?
Well, from an endo perspective, we didn't really do a lot of teledentistry simply because we were open the whole time.
Yeah, good point.
So the second thing, if the majority of teledentistry part, like Dr. Wong, my practice also is a fee-for-service practice. So we don't really go and charge for these sort of things. But when kids are home and they have lots of time on their hand, incidents happen and trauma happens, and that's basically when teledentistry became helpful. Like we had mothers or parents basically reaching out to us, hey, my kid fell off on the bike or on the skateboard, and she took a picture of his mouse or his tooth or the injury area. Should I bring him? Should I be worried? Yes, bring him. No, let's see him a week from now, or so on and so forth. Some infection area, swelling, edema, abscess, all these sort of things, we saw patients who were worried about some kind of swelling in their face. So they send us pictures. Okay, come in, let's see you, or let's send you some antibiotic and bring you on Monday morning. But I can't tell that we have done a lot of those, to be honest, because again, with end, you have to do something. You can't just give them antibiotic and send them home. So
yeah, growing up in a dental family and a dentist myself, you're avoiding that. Well, I'll meet you in the office, right, on a Saturday morning, not knowing anything other than it hurts. But now, any information is probably better than nothing. So something we probably could have done long before this as well. Dr. Kohltfarber, your business is essentially teledentistry, isn't it?
It is essentially. I think that we were wanting to be able to provide services more, in office if you needed us, right away. So we looked into things like doxy.me. And so for a while, we could take questions and that sort of thing. They could just let us know that they needed to talk to us right away if they wanted to show us something. That's how we kind of started out. But eventually it was much easier. Just take a picture and text me, let me know, email me. If we're on social media, just let me know, hey, something's coming. I want to be able to have you look at this image real quick and just let me know if it needs to get sent out or, what we might need to do to manage that patient. So we end up having a lot of that, and of course, we do have, some doctors that are, also seeing quite a lot of kids as well. And so, we did have the trauma related issues, or do I need to send this patient out, or is
Right.
this going to be okay? And of course, all of the people that are concerned that they have cancer, and the doctor just wants to be able to say, hey, quickly, what do you think of this right here? Do you need to see the full volume, or is this good? And so we could help triage really quickly that way, with even just, texting back and forth or email and that sort of stuff. So,
Great.
yeah.
The next question is relates. We hear in the news, or whether it's misinformation, I think it's somewhat true, that the different types of indications, or bruxism because of the stress has increased, or fractures have increased, or areas. Can you let us know if you've seen more of those, or instances that you think may be directly related to people going through a very stressful time? Dr. Wong?
I don't, for me, I mean, I would just speak anecdotally. I don't know that they're actually breaking more teeth. I think they're actually like paying attention more, because they hear about it in the news. They're like, maybe, because how patients don't normally know that a tooth is loose until you tell them it's loose, and they go and they're like, yeah, that tooth is loose, So I think they're just more aware of it, is my personal opinion. I mean, that they're paying attention more to their teeth, and because I've had several patients come up and like, hey, I think I chipped a tooth, and I was like, I'll pull up a picture from like 4 years ago, and I was like, that tooth was chipped 4 years ago. You're just now noticing it. So I think it's just a greater awareness on the patient's part.
Okay, good point. Yeah, because they're all sitting in front of monitors, and their tongue is finding everything for them, I guess, while they're waiting. Dr. Tadros, from an endodontic procedure, you see any greater indication, or the time dentist's office were closed and temps didn't get replaced, or was there any delay of treatment that may have increased endodontic procedures?
From my personal experience during this time, there was an increase of cracked teeth or cracked teeth related endodontic treatment or therapy. There was a time, it hasn't been one single day I don't see a patient that needed root canal, or we had to do some kind of endo treatment related to a result of a cracked teeth. More grinding has been happening, more neglect also has been happening, because people are not seeing their dentists, they're not getting their crowns. If they are in this process, they're not getting their teeth filled after a root canal prior to March. We're seeing a lot of those. And I mean, even today, this morning, I had a patient who split their teeth into half. And why? Because he got the endo a few months ago. He did not go back to his dentist. He got like some olive seed got in there. So the reason, during this time also, I reached an agreement with my referring dentist to allow me to place the core buildup, the permanent filling during this time, because first of all, we did not know when they will be able to come back again and see those patients, and also I don't want to jeopardize, an expensive treatment like root canal until going around with a temporary filling, not knowing when they're gonna be seen again. But with that being said, there was an article in New York Times, I think many people have seen this. There was an increase of cracked teeth or grinding or clenching for many general public population during this time because of stress-related issue because of the pandemic. I agree with Dr. Wong that the pandemic shed the light of many issues that was going on before, like a cracked tooth, maybe you had a small crack and it got worse due to habits, or you've been doing this for a while and it just got worse because you've been sitting home and eating all those chips and snacks and all those sort of things. So basically things have been getting worse. So it's a combination of both, but definitely we've been seeing more of these, like I said, more traumas because kids are home and they're bored, just get them out, do something, and then here you go. Yeah. So
and change in diet obviously can
absolutely
first.
Yeah.
There, Dr. Kohltfarber, you're able to read so many exams or radiographs around the world. Have you seen a trend in anything different, especially with your TMJ training?
Well, I think that overall we've seen an increase in the severity of pathologies because people didn't go in. And so the lesions that we're seeing by the time they are being seen and scanned are much larger or much more severe than we would typically see. And I think the increased number of metastatic cancers that we have found is phenomenal. And definitely atypical when we compare that with, the past, 10 years that I've been doing this. And so I think that has been very eye-opening. And like I said, I really think that people just quit going to their physicians. So as far as the metastatic disease, they're not going to their checkups. They're not being caught when they could have been caught. And they will wind up going to their dentist before they go to the physicians. And so that's why we're seeing the increase in severity of those types of pathologies. But also, with the lesions being larger or more expanded than we normally do, I think people are waiting. They may know that there's something that's going wrong, but they're waiting until they really think there's something's going wrong before they go in. At least during the shutdown, it seems like that's what happened. And so things that before we would have seen in a textbook, we're actually seeing. And so that's really been eye-opening. For us in radiology, it's always interesting to see. Obviously, this is, what we're passionate about seeing. But it is very sad for the patients to be able to see this much disease in our referral-based patients. And so, it's been different.
Yeah, it's tragic, the occurrence from
really
that pandemic and sitting. They may feel something, but they can wait, I guess, what they do.
Yeah.
And finally, I've certainly enjoyed these 50 minutes. We'll take one last question, if that's all right with you. And just ask, in your individual specialties, what either critical issues or opportunities do you see in 2021? Either a furthering of some of these or a new opportunity that you didn't think existed that you'll now continue to implement. And any closing you want to do would certainly be appropriate too, if you wanted to address anything we haven't so far. Dr. Padros?
So from an endodontic perspective, it's definitely the pandemic helped increase awareness about endodontic treatment and understanding the role of an endodontist when it comes to treating patients, not just a root canal, but definitely there are more different discipline in endodontics that can be applied and help patients from trauma to to many different procedures. But from what I'm seeing right now, also there's also an important part, which is the pandemic taught us is management of a practice during this time, understanding that you have to make business decision, and also you have to ensure your staff safety, and you have to be very not everything is written in the guideline, clear about everything. So you have to improvise and you have to use common sense and logic when it comes to this. There's also very important factors, which is the patient factors here. Either patients who are scared to go out and come to dental practices, or patients who are being exposed. Oh, I was exposed. I can't make my appointment. What should I do? We definitely more guidelines will come as we go, especially with the vaccine ongoing. So definitely there are going to be some updates and upgrades on that. And I think, from my opinion, is that specialists has to like specialty practices. You're gonna have to develop your own guideline when it comes to these sort of things, because it comes to a point where you will be seeing more patients who could be carriers or contagious but asymptomatic, and you can't really test everybody who come to your practices because it's not logically acceptable to keep testing people when they come to dental practice if they are asymptomatic. And also, like you have to make like the right decision. You want to be busy. You want to be productive in your practice. You want to have the tools to make sure that everything run efficiently. And at the same time, you want to also ensure everybody's safety. You want your staff to understand that you care about their safety and their well-being. And that's when it comes to apply also like the leadership in your practice and make sure that you lead them through like these tough times. So I think there are many good opportunities when it comes to the technologies involved in that, from teledentistry to CBCTs to all the sort of things that to help us as endodontists to see patients, treat them, keep safety, and at the same time be able to conduct our job in the right way. So,
yeah, great. I was hoping you'd say you were going to get back to your 2-minute videos also, and we'd love to see that again. I think that was a great and great. Dr. Wong, your specialty. I think this is the first webinar you've ever been involved with the word implant did not come up at all. So.
No, this has been great. I really appreciate the opportunity for Henry Schein to actually invite me to speak about something other than implants or gum surgery or something. So that's been really good. I will say, I'll just echo everything that Dr. Tadros said. I agree 100%. I look forward to 2021, to further cement the position of dentistry and infection control as the leaders in infection control. I think that's been the biggest thing that my patients have noticed is that, when the pandemic first started, everybody was like, hey, dentistry is like high risk. Stay the heck out of the dental office. Like they're working in your mouth. You got to get out. You're in the like Dr. Tadros earlier said, hygienists were saying the same thing, some of them anyway. And now that the data is coming out, we're not as high, we're high risk, but we also are take the biggest and the most effective steps to control infection. So I think that's really good for 2021 to re-cement our position there. From a personal selfish perspective, I'm going to continue. My staff and I talked, we really enjoy having an empty reception room. So I think I'm going to continue to have people just check in the parking lot. I love it. It's really nice because, we can kind of speak a little more freely, nobody whispering, not that we go around gossiping anyway, but it's kind of nice to not have to like, shh, there's patients
here. Yeah.
But the other thing too is time management. We're used to in the old pre-pandemic days having sales reps just jump in, open the front door and just, demanding to speak to the doctor, and then it's like, now, they're at least having the courtesy to call ahead and make an appointment. So I think, or they're open to these types of calls too, so that's been really, really good.
Yeah.
Less traffic is makes me a lot happier. So.
Yeah. Hopefully the Henry Schein reps are all reaching out in advance and making sure it's a good time for you. Yeah,
they're the best. And actually, my Henry Schein rep is a good personal friend of mine that I've known forever before she was ever in dentistry. So it's she's always welcome. But it's really neat. You start to see the people that you really want to see, and not so much of the people you don't really want to see. It's
great. All good, Dr. Kohltfarber. Any thoughts on a specific profession for you? I'm sure virtual is in the world much more than it was in the past.
Definitely
your colleagues
was.
As well as yourself. Yeah.
Definitely was. I think that the fact that we were already so far into the virtual world was a huge blessing for us. I think that we will continue to push the envelope as far as what we can do virtually, how we can continue to help, how we can continue to be a really valuable resource for our clinicians and part of their diagnostic team. I think education still is going to be very, very important, whether that's, with our students, or with our clinicians, that sort of thing. Education is very important, especially as more and more people are moving more towards the extraoral units. And certainly with a lot of the guidelines that were coming out from the ADA about moving more towards extraoral versus intraoral, that the demand for education in those areas, understanding, how to go about implementing this in your office, looking at your rate of return with this type of technology. How do I read it? What do I legally have to do? What am I legally responsible for? All those types of questions. We want to make sure that we're answering all of those, and we're making it as easy as possible for clinicians to move more into that extraoral and 3D realm, and also helping them to be able to identify what's going on with their patients and know when they need to refer that on to other specialists. So I think for us, it's just going to be pushing the envelopes in those areas. And I think that we have a really bright future ahead as far as radiology. And we have a great and probably better interaction with some of our clinicians now than we probably had before, because now everybody is online and doing things virtual. And so they're used to it now. And so I think it'll be even easier going forward. So
Great.
Yeah.
We're on the hour, so I've already lied. We have used up 1 minute. So final question, Ohio State or Alabama? You'll be proven wrong when they watch the re-recording here. Any of you have straight up which team?
I'm going Buckeyes for me, just because I don't really like the Tide. Just because I went to OU and we're always getting whooped by them. So
You got Ohio State. Dr. Tadros, you have a preference?
I'm still a Husky guy, so none of the years I don't care.
Dr. Kohltfarber.
I'll go Ohio State.
All right. Picking
Right.
the underdog.
I'm going Ohio State too.
All right,
I love
me
Ohio
too.
State.
Right. We all may be wrong next week when they get this video out. But thank you all very much for taking the time, in either in your offices or at home. I think, Dr. Kohltfarber, you're the only one still has sunshine. It's set over here too. So
Hey, it's California. It's always sunshine here.
great sunshine. Well, thank you for being the supporters, the resources, and the specialists for the GPs, and providing all of the expertise, certainly in this time of never even closing. Two of you never experienced that and stayed true, and certainly picking up all the pent-up demand now as well. So thank you for all you do for dentistry and for the patients and your referral base. For those that are watching, you will be getting an email where you can see this recording probably sometime next week. I appreciate you all standing by. If you had any questions or concerns you want to add, we have answered them all. But if you had anything and wanted to email us, you can email us at webinars@henryschein.com, and we'll get it to the specific speakers, or if you have any ideas for future topics and roundtables. Again, thank you so much and have a wonderful night, and go Ohio State, I guess. All right. Good night, everyone.